Well, it's been over a month since the Health Department launched a COVID-19 vaccination certificate. Several issues have been raised, with some people saying the certificates are not accepted in certain countries abroad. South Africa has administered over 24 million jabs. So let's discuss this now with Acting Director General at the Health Department, Dr. Nicholas Crisp, who joins us via Zoom. Dr. Crisp, thank you so much for your time this evening. Let us talk a little bit about where vaccine certificates are actually welcome. Are these vaccine certificates welcome, for example, in Europe or in America? And this is versus the countries that do not accept as yet South Africa's vaccine certificates.
So our vaccines, good evening, hello Faith, and good evening to the viewers. So our vaccine certificate was designed for use in South Africa, and it was announced right from the word go when the minister announced it a couple of months ago that we would do it in 3 phases. First phase would be a pilot phase. The second one would be a verifiable phase using a QR code in South Africa using South African technology. And the third phase would be an international phase, which requires a lot of crypto security, which is an expensive and time-consuming exercise. So I would need to remind people that other countries' QR codes are also not readable in this country. So it takes quite a while to get that sort of talking to one another across many countries. Yep. So right now, our certificate is designed for verification here so that sports and restaurants and workplaces and such people can use the certificates to allow us or disallow us access to various venues. It will be some time before it is available abroad. So our Department of International Relations has been through our embassies discussing with a whole range of countries our reciprocity for the use of their certificates and ours. And some of them are still paper-based for the other countries, but we are still busy with reciprocity across countries.
You say that it will take time, Dr. Crisp. How much time are we speaking about here?
Probably till the end of the year, and it's got a significant cost associated with it. So at this stage, we're trying to work out where to get the money for the last phase. Remember, the number of people who travel abroad is very, very small compared with the number of people that it was designed for in South Africa. So the first and most important step is to make sure that the certificate is useful here. So what we do is we verify the certificates here for people who travel to countries who require our certificate.
Yeah, just help us understand this and unpack this for a second, because, you know, a lot of times when it was all about getting the jab, it was never mind around how you get to protect your life and the like. But, you know, the aspect about South Africans being able to travel abroad and whether or not we're being taken off red lists of certain countries came to the much celebration, especially to the tourism sector, saying that now we get to see tourists coming into the country and then obviously South Africans getting to experience abroad. But now, if those vaccine certificates are not even recognizable in other countries, I'm sure there are people listening to this conversation that you and I are having and thinking, what was the whole point?
Now, well, they are recognized. They are just not readable automatically, just as we can't read the certificates that come from the United States or from the UK. They can't read ours yet. And that's quite a sophisticated exercise before you can just automatically read them. There are thousands of South Africans who have traveled abroad using valid South African certificates with a code, the automated, the digital code, and they get them stamped. Certain countries don't mind at all, and others do mind and want them stamped by our office, and we do that. So I think, you know, the public must not be misled into what the purpose of the vaccination certificate was. It was primarily for use in South Africa. That was the first phase. That's what was announced. That was in the media releases, and it was very clear. And we were very clear from day one that the third phase would be the rollout to enable the automatic reading of the verify. And I mean, it's a fraud protection program to protect us as South Africans, that it will be readable abroad. That will come, but it will come in due course.
Yeah, I mean, when you're speaking about the certain countries that do accept the vaccine certificates and the certain countries that do not, are we going to make available then that list where certain countries actually allow the vaccine certificate, whereas other countries will not, and the vaccine certificate is not readable? This is just for the purpose of saving time and money, so that, you know, when you do travel abroad, you do not find yourselves at customs or whatever, and then they, you know, you slap bang with somebody saying, sorry ma'am, or sorry sir, you cannot get into this country because your vaccine certificate is not valid. That would have cost a whole arm and a leg just to reverse that transaction. So are we going to make those details of the countries that accept these vaccine certificates and the countries that do not maybe available so that we can all know where we are sitting at as a country?
Well, what I'll do is I'll talk, this is not a health matter. This is a Department of International Relations matter. So I will speak to my colleagues in the Department of International Relations to establish whether that list is already available. But we've been working with JIRCO, and we know that they have been working with other countries through the embassies. We see the email trails to many of those countries. So we know that that reciprocity has been taking place. But I don't offhand have that list, and we would have to get it from our colleagues in the appropriate government department.
Yeah, it would be absolutely worthwhile to be able to have that synergized communication strategy,
Sure.
just so that South Africans do not find themselves in a country and then they have to turn back around and go back home. But I want us to speak a little bit about also the numbers. You see, Dr. Chris, the numbers are out. We're seeing that we've seen a certain spike, so to say. 700 cases of over 700 cases of COVID-19 detected. I think it was on Saturday. Now we're sitting with about 687 new cases. At this point in time, are you all concerned about the increasing in numbers?
Well, we've been watching the numbers since Monday when they started to rise, and they are quite localized to a number of locations, primarily in Gauteng, and the bulk of them are in the Tshwane area, and they seem to be clustered. So at this stage, the advice that we're getting from those that are monitoring on the ground is that it seems to be localized outbreaks. But obviously that's a concern, because people are moving around quite a bit and are socializing. So we will trace during the course of this week. I've asked that we're all on high alert and that we get immediate reports of any movement of to other clusters or other hotspots. But it does seem to be primarily a problem in the Tshwane area of Gauteng. And it would be, if that remains like that, it's something that we'd be able to deal with contact tracing and quarantine and isolation of the people concerned. But obviously it is a worry, and we are watching it.